Hello everyone. My name is Dalius Jatuzis. I am president of Lithuanian Stroke Association, and here I would like to share my insights on implementation of Stroke Action Plan Europe in my country, Lithuania. Like other countries, we started with discussions about Stroke Action Plan in AZO working groups. However, in further preparation for the presentation of this initiative to our country's doctors and government, we wanted feedback and opinions from our colleagues working in the field of stroke. Therefore, a Lithuanian translation of declaration was prepared by our experts, and the draft translation was presented and discussed at the annual stroke conference this April, less than 2 weeks before the official presentation of the declaration. We then provided a translation of the declaration to the authorities, the Ministry of Health and the government, and we succeeded. The declaration was signed by Mr. Antanas Matulas, the chairman of Health Affairs Committee of the Parliament of Lithuania on May 11th. So, in this way, we have achieved our short-term goal to obtain official acceptance and support from the country. Next week, a press release on Stroke Action Plan and Lithuania's support for this initiative was issued through several media channels. The principles of declaration and some of the tasks were quoted at the quarterly meeting of Lithuanian Stroke Monitoring Committee at the end of May. We members of Lithuanian Stroke Association, currently working on a national standard for stroke treatment and care, will try to implement the main tasks of Stroke Action Plan Europe into the text of National Lithuanian Standard, and a direct contact meeting with government representatives in order to discuss ways how to make this declaration a reality in Lithuania is scheduled for this autumn. But this success story is just the tip of the iceberg. The transformation of stroke management and control, according to modern standards, in our country really started 7 years ago, when the development of an integrated network of stroke centers throughout the country began. Let's have a glimpse into the organization of current stroke care in Lithuania. Brief history of the development. Lithuania is a relatively small country in terms of area and population in Eastern Europe, on the eastern shore of the Baltic Sea. Slightly less than 3 million people live here. Nevertheless, we have high incidence of stroke, mainly due to inadequate control of vascular risk factors. And despite the fact that first IVT thrombolysis was performed in 2002, and since 2007, IVT was recommended as a first-line treatment for acute ischemic stroke by our guidelines. And first mechanical thrombectomy was performed in 2012. Before 2014, just less than 1% of all ischemic stroke patients were administered reperfusion therapy in Lithuania due to various barriers. So a real breakthrough in improving the quality of stroke care and universal access to modern treatments for the entire population of the country, not just in university hospitals and major cities, began in late 2013, more than 7 years ago, when stroke, along with 5 other pathologies, has been declared a national health priority. It was really the most important step for the beginning. Then 2 orders of the Ministry of Health were issued in the beginning of 2014. First order laid the legal imperative basis for the definition and establishment of stroke centers, and the second order actually established a National Stroke Management or Steering Committee. And now we have 6 comprehensive stroke centers in red spots as advanced stroke centers with ability to perform both IVT and thrombectomy at any time of the day, and 5 intermediate hospitals in green dots. as primary stroke centers with the ability to perform IVT at any time. Our goal here is to take the patient with suspicion of stroke to the nearest stroke hospital in no more than 1 hour. Considering the short distances and good roads in Lithuania, such a goal is realistically achievable. However, the stroke care network consists of a variety of links, not just stroke centers, and they are all very important, starting from suspicion of stroke, then ambulance, a primary stroke hospital, advanced stroke center, district hospital, rehabilitation institution, outpatient or primary care center, patients organization. So all these links are essential and coordinated action is vital. And we are now making a great effort to improve this logistic scheme. We have great help from Stroke Integrated Care Management Committee. All stroke centers are represented in this management committee, as well as representatives from Health Ministry, from State Health Foundation, and other official institutions. We have regular meetings every 3 months discussing key performance indicators, numbers, achievements and problems from all centers, and we are obliged to present quarterly report to the Ministry of Health. So permanent feedback is guaranteed by activities of Stroke Steering Committee. What are our achievements? First of all, a significant increase of percentages of reperfusion therapies in Lithuania. In 2020, almost 15% of acute ischemic stroke cases were treated with IVT. More than 7% of cases were treated with mechanical thrombectomy. It fits very nicely with the Stroke Action Plan Europe task for 2030 to achieve IVT more than 15% and a mechanical thrombectomy more than 5% of acute ischemic stroke cases. And the achievement is improvement in key performance indicators. For example, decrease of door-to-needle time. All stroke centers did a great job, and currently all stroke hospitals are able to match golden hour criteria, means no more than 60 minutes from patient's arrival to emergency department until the start of procedure. The same could be said about other key performance indicators as well. How to achieve this? I think one of the main possible ways is continuous medical education and adherence to international guidelines and participation, active participation in international registries and collaborations. These are crucial for further improvements in national stroke care. Also very important to use the best experiences from well-known patients in society. For example, in Lithuania, we have ambassador of stroke, our maestro, chief conductor and art director of the Vilnius Chamber Orchestra, Mr. Donatas Hatkus, who suffered a stroke more than 5 years ago. The maestro openly talks about the stroke he suffered, hoping to save others. He participates in our press conferences, in activities dedicated to World Stroke Day, and so on. Conclusion, integrated efforts of leading stroke specialists, government support, well-balanced stroke care network, active patients were essential for the breakthrough of modern therapies for acute stroke and overall stroke care in Lithuania. Nevertheless, we have a lot of challenges for the future. That means better stroke prevention, establishment of TIA clinics, better use of modern technologies and artificial intelligence in stroke imaging and treatment, further improvement of stroke care network, also establishment of an active patient organization. So political support has already been obtained, and we are proud of this nice beginning. However, the successful implementation of Stroke Action Plan Europe into real life also requires further steps, practical steps and plans of the Executive Ministry of Health. Experts of Lithuanian Stroke Association are ready to help in the practical implementation of Stroke Action Plan Europe principles and goals in Lithuania, and we wish you the best luck in your countries as well. Thank you for your attention.